Susanna. I'm a paediatric nurse specialist and I work with children with HIV. I've created a few little videos about HIV medication and how it works and how to take it safely. I hope you find them useful. So taking your HIV medication every day keeps your white blood cells really strong, and it stops the virus from attacking them and destroying them. It helps your immune system stay strong and you'll be able to fight off other infections and you'll stay healthy. The HIV virus likes to attack a type of white blood cell in the blood which is called the CD4 cell, which is part of our immune system. The HIV virus attaches to the CD4 cell and enters it, and then it makes lots of copies of itself, which destroys the CD4 cell. How I like to think about the HIV medication is it acts a little bit like a wall, and it blocks the virus from entering the CD4 cell. So when the virus can't get into the CD4 cell, then it can't make more copies of itself, so the numbers in the blood go down. When we take your blood tests in the hospital, we check to see how many CD4 cells are in your blood. This shows us how well your medication is working and how strong your immune system is. We also check something called your viral load, which shows how many copies of the virus are in your blood. If your medication is working well, then your viral load should be undetectable. These medications are used by millions of people around the world and are very safe. But as with any other medication, occasionally they could cause something called a side effect. This is when something feels different to normal, such as headaches, tummy pain, feeling sick, loss of appetite, or sleeping problems. If you feel any side effects to the medication, it's important to let your doctor or nurse know. Side effects often go away once your body gets used to the new medication, but sometimes it can take longer, so your doctor might talk to you about trying other medications instead. If you have HIV and you don't take your medication, then the virus will keep on multiplying and increasing in the blood. It will keep attacking the CD4 cells and the CD4 cell supply will decrease. When this happens, your immune system will get weaker and you won't be able to fight off infections anymore, and so you could get very sick. If you miss dose of the medication or only take it some days, then the virus can get stronger. Imagine the medication is like a wall around the CD4 cell. If you miss a day here or there, it's like taking a brick out of the wall, which makes a hole or a crack for the virus to get through, so it can attack the CD4 cell. The virus gets stronger and the medication might not work so well anymore. We call this drug resistance, as the virus is resistant to the medication. And we want to try and avoid this if at all possible, because it'll allow your medications to work well for many years. Everyone is different and everyone's body responds differently to the HIV virus and to the medication. Your doctor will tell you which is the right medication for you to take, and it might not be the same as what your mum is taking or your sister or your friend. There are many different types of medication options, so if you want to change it or try something different, you should always speak to your doctor. You must never take any medication that is not yours, even if that person has HIV, as that wouldn't be safe. You must only take your own medication. If you're finding it difficult to take your medication, you should speak to your doctor or nurse. If you're finding it difficult to swallow the tablets, we can give you tips on how to make it easier. If you're struggling to remember to take your tablets, there are things that can help, such as setting an alarm or a reminder, or using a Dosset box, or getting a friend or family member to remind you. Or you can even take it together and remind each other. It's important to speak to your doctor or nurse if you're having trouble, as we are there to help and we can give you advice about this.